Good morning, everyone. I'm Derek Miller, and on behalf of the Salt Lake Chamber, I want to welcome you and thank you for participating in today's webinar. I also want to thank our speakers and moderators for taking time to be with us today. This webinar is hosted by the Roadmap to Recovery Coalition, part of the Salt Lake Chamber. Our sponsors for that coalition include Mountain America Credit Union, WCF Insurance, Intermountain Healthcare, Deseret Management Corporation, Staker Parson Materials and Construction, and Rio Tinto Kennecott. Today we're covering a couple of important topics. We're going to be covering, as you know, the vaccine rollout. Today is a historic day with the first person in the West being receiving the vaccine in the United Kingdom. I'm sure we'll be talking about that, and more specifically, we'll be talking about what that rollout looks like for Utah. But before we get to that topic, we're grateful to have Senator Mitt Romney of the U.S. Senate representing Utah here with us to give us the latest on what's happening with COVID relief talks. Senator Romney, we'll turn it right to you.
Thank you, Derek. I appreciate this chance to speak with our colleagues, and I'm going to give you an update on negotiations going on. You probably heard that a group of Republicans and Democrats from both the House and the Senate have been negotiating over the last several days to try and come up with a relief plan that might pass on a bipartisan basis, and we've made good progress. I can't tell you whether it would be passed in total or whether instead the Republican and Democrat leadership, that's Nancy Pelosi and Mitch McConnell, would agree instead to take parts of it and to pass parts of it and not to pass all of it. The two parts that are the most contentious are, number one, money going to states and localities, and number two, liability protections for universities, schools, hospitals, and businesses. So those are the areas that are very much in contention, and whether or not they get in the bill anytime soon is uncertain. But let me give you a sense of where we are and what progress we're making. Number one, you care about the PPP program, and our plan there is to put $300 billion more into the PPP program, to allow people who've already received a PPP loan to get another PPP loan. Like the last, it will be forgiven. It will be available to businesses which can show that their revenues have declined by, let's say, 25 or 35%. That exact figure hasn't been negotiated yet. So that's the biggest piece of money. The next largest piece of money is to the unemployment insurance effort. And that would be a supplement, no longer at $600 a week, but at $300 a week, a federal supplemental payment for the unemployed that would be available from January until April. Then there's some other monies. There's about $45 billion that goes to transportation. And by that, I'm talking about $17 billion going to airlines. There'd be some $5 billion going to bus companies. There's money going to transit entities. And there's also money going to airports. So Salt Lake Airport would get some funding because, of course, of the dramatic reduction in volume at the airport. By the way, there's also money going to concessions at airports because, of course, they've been hurt. There's $16 billion going to vaccine distribution by state. So it's not the federal vaccine dollars, but state vaccine dollars, as well as PPE. There's healthcare system relief of about $35 billion, largely to rural hospitals, but also to other hospitals, urban center hospitals, recognizing that they have not been able to do as many elective surgeries as they had planned, and as a result, they need some help. There's $82 billion going to education, of which 20 goes to higher ed, and 62 billion goes to K through 12. There's housing assistance funding. This is basically making sure that landlords, particularly small landlords that can't get rent from some of their tenants, are able to get rent from those tenants so that those landlords don't go under and, of course, take the banks with them. There's $26 billion going for agriculture and nutrition programs. So some of that goes to farms and ranches to purchase food that's needed for those that are in need. And then the other is going to food stamps and other programs to help those that need nutrition help. There's $10 billion for broadband expansion into rural communities. So we ought to get some portion of that. There's $10 billion that goes to child care facilities to make sure these child care establishments don't go out of business. $8 billion is planned to go to tribes for a whole host of matters, from food to transportation to health and so forth. And then with regards to state and local, I know most of you are not interested in that, but there are some who probably are. We're planning on $152 billion going to state and local. Of that, 40% is required to go to local, meaning cities, towns, and counties. And it's not optional on the part of the state. It is required to go to locality. So the state can't hold it back. 60% is kept by the states. And that 60% is based 1/3 on the state's population and 2/3 based on the amount of its revenue gap of this fiscal year, estimated, the fiscal year ending June of 2021, compared to June of 2019. So if you have a revenue gap between those two periods, estimated, you would get a portion of the relief based upon that revenue gap. And finally, the last issue is liability protection. This is protection for people who have had injuries from COVID sometime during 2020 or during the first 4 months of 2021. Republicans are insistent that a special standard be given such that businesses, schools, hospitals, universities don't get flooded with lawsuits from people who got sick or who may have died during that time period when, frankly, most of our entities didn't know quite what they needed to do to protect people. So if you've got a point of view on this, if you want to see something like this passed, please give Senator Lee's office a call, tell him to get behind it. Call your Congress people. We need people to hear whether you want this to happen or not, because there are a lot of folks, particularly among my conservative Republican colleagues, that are saying, no, we're not going to do that. And so if this is something you think makes sense, make sure and let your voice be heard.
Thank you, Senator Romney. And not only do we want it to be passed, we need it to be passed. As you know, so many of these businesses 9 months into this pandemic in Utah are still struggling. The chamber sent a letter to all the members of our congressional delegation asking for this to happen, pointing out what they hopefully already know, that it needs to happen. We know your time is short, Senator. I want to thank you for this update. I want to thank you for leading this effort in Congress. And I want to just ask you one quick question. And if you already mentioned it, I apologize that I missed it. But right now, the state in the near term is wondering what to do with those initial CARES Act dollars that they were required to spend before the end of the year, and have done a lot of good things with that money. But in some cases in the state of Utah, there's still a couple $100 million that has not yet been spent. Do you anticipate that there'll be some extension of that out of Congress so that the state does not have to give that money back, but can continue to put it to good use?
That is a portion of this legislation. We call it the $908 billion bipartisan deal. One portion is that the monies that have been allocated to states, localities, and tribes does not have to be spent by the end of this calendar year, but can go until the end of the fiscal year and even 90 days beyond that. There's pretty much agreement on that. There's also agreement that the money can only be used for COVID-related expenses. It can't sort of plug other gaps. But the new money I'm talking about, the $152 billion of new money, that is intended to be used for a revenue gap. So it can be used for any purpose the state feels is appropriate.
Very good. Thank you again, Senator, and thanks again for your leadership. Now we're going to turn our time and attention to another important topic, and that is the topic specifically of the vaccine rollout nationally as well as right here in Utah. And I want to turn the time to one of the chairs of the Roadmap to Recovery Coalition, Mikelle from Intermountain Healthcare.
Thank you, Derek, and thank you, Senator Romney. That was a great update. And thank you to all of you for joining us for the webinar, The COVID-19 Vaccine is Coming. How should the business community prepare? Which is sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. As Derek said, I'm Mikelle Moore. I'm one of the chairs for the Roadmap to Recovery Coalition and also Senior Vice President and Chief Community Health Officer for Intermountain Healthcare. For those that don't already know, the Roadmap to Recovery Coalition is a business-led coalition focusing on implementing and promoting our economic recovery here in Utah. Over the past few weeks, we've heard a lot about how the COVID vaccine is coming, how it's going to come to Utah, and has left many of us wondering, what exactly does this mean for our businesses and what's next? We hope that after this session, you will feel better informed about the COVID-19 vaccine release plans on a statewide and national level, and how the business community can strategically prepare, and what the average person, family, should expect. Today, we are joined by Rich Saunders, Executive Director for the Utah Department of Health, Rich Lakin, Immunization Program Manager at the Utah Department of Health, Jack Hedge, Executive Director of the Utah Inland Port, and Marc Bennett, President and CEO of Comagine Health, who will serve as our moderator. It should be a very informative session. Marc, take it away.
Thanks, Mikelle. As Mikelle mentioned, I'm Marc Bennett. I'm co-chair of the Salt Lake Chamber's Health System Reform Committee and CEO of Comagine Health. And I'm going to be helping to facilitate the discussion with each of our guest speakers today. If you have questions during the presentation, we'd invite you to submit those questions in the Q&A function on Zoom. We'll do our best to answer as many questions as we can. We're going to first have an opportunity. We're grateful for Senator Romney being with us, but our first presenters on vaccine efforts are Rich Saunders and Rich Lakin from the Utah Department of Health. We welcome both of you. There's a lot of speculation going on about what's going to happen. Can you share with us the release plan for the COVID-19 vaccine in Utah and give us a little bit of introduction?
Thank you, Mark. This is Rich Saunders with the Utah Department of Health. We're grateful to be with you again. We've spent a lot of hours together over the past many months. And we are very aggressively focused on the distribution of vaccines, how to lobby for increased doses, and trying to figure out how to get it from the manufacturer into people's arms so that we can become vaccinated from this virus and eventually move forward out of this pandemic situation and back into a new level of life. And so with us, grateful to have Rich Lakin, who oversees the vaccine distribution, the vaccine plan, and the program. So through the course of this, maybe if I can just turn some time over to Rich Lakin to share an overview of the plan. Would that be appropriate?
Yes, that'd be great. We'd love to hear from him.
Yes. Hey, good morning. This is Rich Lakin again. I'm the Immunization Director at the Utah Department of Health. And I'm going to just kind of maybe discuss a little bit about how this COVID-19 vaccination plan starts. Basically how, I'll give you like a real general overview, and I think it probably, there'll be many questions that will arise from this. So the way we've done this is that we have broken up Utah into specific areas in multiple jurisdictions. We've taken it at local health departments, we have health systems, we have Indian health facilities, and we have statewide coordination. So facilities that have the capacity to administer vaccines under each of these different phases and waves that we have introduced, they will receive vaccine directly from us. For example, Intermountain Healthcare, University of Utah, HCA, Stewart Hospitals, they will receive the vaccine from us. They will then take that vaccine and they will vaccinate their staff according to how they see fit. To ensure that they can start working on staff within each of their hospitals. We start this whole vaccination process with some key hospitals that CDC had asked us to identify in the very early beginnings, and this is back in probably September, where we had to identify some hospitals that had some ultra cold, and we also had the responsibility to identify 1 to 4 hospitals that were seeing the most burden. And at that time, those that were seeing the most burden were University of Utah, LDS Hospital, Intermountain Healthcare on 53rd, Utah Valley Regional Hospital, And then we added Dixie Regional Medical Center also because they have the ultra cold capacity. Due to the Pfizer vaccine, it makes it difficult because it comes in minus 80 degrees Celsius, and it comes in a minimum doses of 1,000. So you can see how we have a logistics issue to ensure that all of the hospitals at some point can receive vaccine. So kind of fast forward now to today, where we stand is that we have put in an order for those 5 hospitals. We're also in the process of onboarding those additional 8 more hospitals along the Wasatch Front. And I won't go through a name of them, but there'll be a total of 13 hospitals that will receive vaccine the week of December 13th. So the EUA is going to be approved approximately this Thursday. And then ACIP recommendations will make their recommendations on the approval of the vaccine. So most likely, we will have vaccine delivered on approximately around the 15th. If not on the 15th, it'll be during that week, and it'll go out to about approximately 13 hospitals, utilizing every bit of vaccine that we have available here in the state. Then we move into the following week where we just continue to expand and adding all of the hospitals where they can receive vaccine. And as we move into that stage, then by the time we reach the last part of December, that week of December 27th and the first part of January, we are working with our federal partnership and the pharmacy partnership with Walgreens, CVS, and we also have a contract with Community Nursing Services to start heading out. This will come from state allocation, to start heading out and taking care of long-term care facility staff and residents. So during the month of January, we're going to be having kind of a tandem workload that is going out to all hospitals, all long-term care facility staff and residents. We will also be encompassing all healthcare workers, also somewhere within that January timeframe. And we're moving into February. So our goal for December and January is to ensure that all healthcare workers are vaccinated, not only at hospitals, but also private practices, dentists. It's a very broad umbrella that we encompass here. And then we also got our long-term care facilities, which includes the staff and the residents within those facilities. That moves us into, after February, we also got other groups such as first responders that will be vaccinated in that February timeframe, and other essential workers that will fall within there. So that kind of takes us up to our time frame within kind of our, basically there's a lot more to it, obviously, than what I have shared with you just based on time. But when we go into March, we will start looking at other priority groups. By that time, that April, May, June timeframe, it will probably be opened up to all of Utahns that would like to receive it in that April timeframe. Again, I've always stressed the importance of that vaccine is going to drive the response. If we have enough vaccine, we can roll it out to our partners as quickly as possible. If we don't have enough vaccine, then we may have to be a little bit more strategic in ensuring that those over the age of 65 receive it. And also some other communities such as tribal communities that have been hit very hard with this. So I'll go ahead and leave it there, and I'll turn it back over to you, Mark.
All right. Thank you, Rich, for that introduction. I think we have a substantial amount of time available for question and discussion. So if you have questions, I'd again remind you, you can submit those in the Q&A feature within Zoom, and we'll try to get to as many of them as we can. I'm going to start with a question to tee things up. And I just ask the two of you, as businesses plan for the upcoming year, how do you recommend that they strategically prepare for when the vaccine is widely available? What considerations would you recommend that they take into account as they're doing that preparation?
I don't know if it looks like Rich wants me to respond to that. So I think that the main thing is, as we think of the business community and we move into that, that April timeframe when all of Utahns have the opportunity, I think we need to understand that without a vaccine, this could be a way of life. And I think for businesses, not only to protect those that work within those businesses, they need to be vaccinated. It's very important. Vaccinations are one of the greatest public health achievements that that's ever happened. And if we didn't have them, we would continue to see childhood diseases. Smallpox, measles, mumps, rubella, diphtheria, tetanus. I mean, pertussis. I could go on, and all these childhood vaccination or diseases that we used to see, we just don't see anymore. And this is just another piece of the puzzle when it comes to the coronavirus. If we don't get enough of the population vaccinated, then we don't get that herd immunity. And this could be something. Again, we don't know that much about coronavirus. We're still continuing to learn about it, but we need to protect not only the businesses that are working and the contacts you have within there, but also the people that come and see those businesses. They should be vaccinated to protect. So it's really a large encompass of individuals, businesses, and everybody kind of coming together and ensuring that we get vaccinated. And if we can reach a certain level, and I don't know what that level is yet, we can actually get this thing under control, and we can get back to what we have seen in the past.
And I wonder if you could, one of you, Rich or Rich, comment a little bit upon the state's plans for addressing the resistance that exists to vaccination. I know there has been polls that show that not everyone is prepared for a vaccine or prepared to get a vaccine. So do we have specific plans to begin to increase acceptance of this as a core strategy as a state?
I could comment on that. We've done some polling to try to determine what % of the population is resistant to it. There are some that are strongly opposed to it. There are some who are middle ground, and there are some who will take it, the first minute it's available. And our numbers suggest that somewhere near 70% of the population is at one level or another open to receiving the vaccination. We know in a typical influenza year, we get somewhere in the low 40%, somewhere in there. Rich, you can correct me if I'm wrong, but somewhere around 40% vaccination on the influenza. So I think this is an interesting situation that we're in. We are not in. There is no appetite for mandating the vaccine, and from a public health standpoint, but we do want to make sure that good information is available so that people can make the most informed decisions. And there are many who will receive the vaccination that, based on the results of those individuals, that will send a message to people that it's safe, that it's effective. And we hope for those things to happen, and we anticipate that they will. We also are trying to prepare different media bites or public messages that focus on just how safe is the vaccine, so that people can at least hear the facts about safety and be well informed that way, and other public messaging. Those are some of the things that we're working on to help navigate through this. We don't expect that 100% will want to be vaccinated, but we're hoping for enough to be willing to be vaccinated to change the course of this situation that we're in.
Thank you. We do have a number of questions queuing up in our from participants in today's session. So I want to get to a few of those if we could. I wonder, Rich, Lakin, if you could just say a little bit more about how the state is determining who is considered an essential worker.
Yes. So first of all, we take ACIP recommendations with the first few groups. So ACIP recommendations is healthcare workers is a priority. Long-term care facility staff and residents are a priority. So those are ones that, as essential workers, they are at the top of the list. And as I had mentioned earlier, those are the ones that we are really stressing to get vaccinated early. As we move further, we and how we kind of define what essential workers are, it really depends on who you ask. First of all, you know, everybody believes that they're essential worker, and you know they are essential workers in their eyes. But we've got the task of the hard part of it is to try to define where an essential worker would fall within this line. So we have a risk level model that we follow, and basically what this risk level model represents is it takes an occupation and it puts them into a risk category based on the exposure that they would have. So for example, a healthcare worker could not work from home and they are highly exposed to the COVID. Okay, they're screening patients, they're testing patients, et cetera. As compared to another that would fall on a scale of 1, which would be a low, they would be, you know, they can work from home and have very little exposure. So we have a categories 1 through 5, low, 1 being the lowest and 5 being the highest, and we categorize those. However, based on those recommendations that we have, 1 through 5, we work with a strategic vaccination coalition group that provides us guidance on where an essential worker should fall. And you know, part of that piece is also the impact to our economy, or the impact to that organization, which is part of that we've added into that model. So that's kind of how we define what essential workers are. As you can see, it's a very difficult task because again, everybody, you know, in the eyes of somebody would say that, you know, I'm an essential worker, and I would agree with them, but we've got the hard task of trying to define exactly where they would fall within that scale of 1 to 5, and where they would fall within the time frame of our phased approach out to receive the vaccine.
Thank you. I see a series of questions here related to the vaccine itself, side effects. Could you speak to what we know about potential side effects and or what people should expect as they take the vaccine in that regard?
You bet. So we actually, because the EUA has not been approved, we have not received what we call as a vaccine information statement yet, which actually describes all of the side effects that would be associated with the vaccine. However, there are a few things that we know. It could be very much like receiving a flu vaccine, where you'll have a sore arm. You know, it could be sore for several days. There could be some redness. An individual could have a fever. Some could have flu-like symptoms. They may be out for a day because they don't feel well. And that's basically what we know at this point. We'll know more after the 10th, after the EUA is approved.
Okay. Thank you. And then a group of questions here about sort of how the vaccine will be administered. Do you have a sense, either of you, how long we think it will take to vaccinate 60% of the population? Is one way this might get asked. I mean, there's a lot of steps as you described, and there's 2 doses and a lot of logistics. What's your best estimate of how long that might take us?
So on the background, and then Rich, if you'll comment on the literal time that we expect, but we, just so you know, we are working with multiple groups of individuals and organizations to help us to figure out how to distribute the vaccine. There's 2 issues. One is getting it from the manufacturer, and then the other one is getting it into people's arms. And so we're working on both of those. We have an existing infrastructure for vaccines. that we use normally. And on top of that, we are putting together a surge or a blitz infrastructure that allows us to administer the vaccine much quicker than through the normal distribution channels. So we're working on both of those aspects of it, so that the one thing that our whole goal is that there is not a constraint in our processes. The constraint, the only constraint that's acceptable is that we don't have the vaccine from the manufacturer yet. Once we get the vaccine, our whole mission is to get that into the arms of people so that we can provide that safety. As far as time frame, Rich, would you mind commenting on that?
Yeah, so in regards to time frame, like you said, if the vaccine is rolled out the week of December 13th, and we have continued flow of vaccine, and let me just mention that, you know, our partners, as the more that we onboard, okay, the more hospitals we get on, the more the local health departments participating, community nursing services, and then also our pharmacy partnership, which not only is it Walgreens and CVS, but it's all pharmacies within the state of Utah that want to participate. We know that using pharmacies greatly increases the amount of vaccine that can be put out into the state of Utah. So that's why we are really encouraging all pharmacies to participate and get them signed up so that they can help us with this. Regarding time frame, if we receive vaccine the week of December 13th, I would anticipate that by the time we reach July, that we are pretty darn close to where we have reached at least 50 to 60% of the population that would want to receive it. And that's the age of 18 and older, not under the age of 18. So these Pfizer and the Moderna and the other vaccines so far have only been licensed for 18 and older.
So Mark, just one other comment on that. To this group, you know, the more distribution points we have, the faster the vaccine can be distributed. And each of those distribution points have to be onboarded in order to be authorized to distribute the vaccine. And so anything that this group can do to increase the number of Rich, you've taught me the language, and the points where the needle goes in the arm, it's the distribution points, or the dispensing sites. That's what it is, dispensing sites. The more dispensing sites we have, the faster we can distribute the vaccine. So we can take this offline with anyone that would like to talk further about joining in this effort. But we solicit as many organizations that can be authorized to distribute or dispense the vaccine to reach out, and let's increase the number of those sites and get them onboarded quickly, so that, again, the only delay is that we don't have the vaccine from the manufacturer.
So thank you. Those are really helpful. I wonder if we could just shift gears a little bit and talk about the extent to which you understand you said, no, we're not going to mandate this from the state standpoint. There's a couple of questions here about how businesses can operate. One is, can they mandate if they want their employees to take the vaccine? And a sort of related question from the other end of that is, if they're dealing with employees, how would they know whether their employee has, or a customer potentially has the vaccine? Are there resources going to be available to tracking who's got the vaccine and some way to know that along the way?
Rich, I'll defer to you on the second question about the tracking and the ability to inform businesses or others that you have been vaccinated. On the first question, I do not know the legal answer to that. I will find out. We've been asked that several times. I have heard things in those discussions that a business can choose to require certain things from its employees, but I will check and I'll get that back to this group through Derek Miller, if that's okay.
Okay, thank you.
And And regarding the second question, so every vaccine that is administered, so every COVID vaccine that is administered goes into our registry. And that registry then can be queried if businesses would want to see how many people within their company had been vaccinated. Or if, for example, if they did have a requirement, that individual can request a copy of their immunization record, and they can then take that to their employer. We also have the option of, it's a Docket app, where an individual can download the Docket app either on an Android or an iPhone, and they can have access to not only their individual immunization records, but also others within their family. They can access those records for vaccines.
Thank you. So could we just talk for a minute? I see a number of questions here where people are asking about, sort of administration of the dosing. So between the first and second dose, based on the Pfizer or the Moderna vaccine, are we talking, it doesn't work without the second one? Can you confirm that for people and help us understand how that process will work, how we'll follow up to make sure people are getting the second dose, and what the process like that will look like for that?
Yeah, so we don't know what the efficacy is right now with the first dose. However, we know that for the Pfizer vaccine, if you receive the Pfizer vaccine, at least 21 days later, it has a 95% efficacy. And then also for Moderna, it is the same, except however, Moderna is 28 days apart. And if you receive that second dose, then again, you have a 95% efficacy. In regards to those that need to be notified on how to receive their second dose, Intermountain and University of Utah have systems in place where they can notify staff when to return for their second dose. Also, on part of the ancillary supplies that come with the vaccine, there's a card where at each dispensing site, that card will be filled out with the name, the lot number, the vaccine, the Pfizer vaccine, the date that they received it, and then the date when they should return. And then we also, again, as I had mentioned in that Docket app, we have the capability, if somebody wanted to look up their record, they could look that up and see that they're due back in 21 days or 28 days, depending on the vaccine that they received. We also have the capability for each of the dispensing sites, such as private physicians, pharmacies, local health departments, where they can query our registry and they can pull up a list of those that need to return for their second dose, and then they can notify them.
Well, thank you. I want to shift us a little bit here again and just talk about, so in the interim, this may take a number of months. What are the messaging and what's your encouragement to businesses and to citizens generally about continued vigilance in the interim while we're waiting for a vaccine to make its way through the system? Mask wearing, other kinds of public health practices and guidance.
We're working very, very diligently to try to very carefully scrutinize policy that there are only certain levers that we can pull when it comes to the virus anymore. I think we've been through enough. We've all learned together. There are some levers we should not pull, even though we could. There are some that we really need to pull. And so if you can picture it, there's a bridge from today to the day when life becomes different than it is today, which means that everybody doesn't have to be always wearing masks, and we don't always have the daily report on the case counts and all those kinds of things where people live in this kind of a state of wonder and fear and concern. I think the day is coming, and there's a bridge from today to that day. And as we walk across that bridge, the hope is that we can manage the case counts at some responsible level so that these hospitals that are very, very taxed right now don't have to implement crisis standards of care, or we have to take on care at the expo center, for example, by lining out beds there. But we just have to be very delicate and work together at doing whatever we can so that we don't compromise care for people that need it and that need it most, and the kind of care that can really only be given in these hospitals. So in the walk across that bridge, it's about just simply wearing masks. There's lots of studies now that validate that mask wearing does reduce the transmission. But that's why we have a statewide mask requirement. And I think that will stay for a while. And we call upon businesses to help us to encourage their patrons to wear masks as well. Also, any kind of sanitization, those kinds of things that keep things clean, surfaces clean, high touch point areas are very good. And physical distancing, of course, is the key. Keeping people apart from each other where possible, from different households. Any of those types of basic, well-known behaviors that we could have in businesses would be very, very crucial. We'd also invite people to think twice about gathering together. For example, my daughter was just invited to a big friend Christmas party where all these couples were getting together. She asked me, "Dad, should I go?" And I said, "After all that we've been through, what do you think?" And this is her and her husband. And she said, "Well, I don't think I feel comfortable going." And I said, "Well, you know, this is just an odd year where we have to kind of make those kinds of decisions." And so I think you're onto the right answer, which is kind of make adjustments in your plans to reduce the numbers of households getting together at one given time in a location, especially when they're not masked and aren't able to be physically distanced. Those are the kinds of things that we just kind of have to figure out where that balance is moving across this bridge. The vaccines will start, but they won't take the real effect that we need for months. And so in the meantime, it's this walking across the bridge together safely and implementing whatever behaviors and practices that we can that will cause these case counts to not take off greater than what they are. I will say that we never imagined that we would be handling 3,000 and 4,000 cases a day. For some miraculous reason, the hospitals have been able to step up and really do a tremendous job at handling the loads that have been placed on them. They can't keep it up, and they can't. I don't know how much more they can take, but we've been successful so far in many fronts, and also we've been very successful at keeping businesses open and trying to promote commerce and people getting out and exchanging money for goods and services. And all of those are part of the balance where our whole focus is trying to keep kids in school, in-person learning. We've got some pilot tests we're working on right now that we'll be implementing at the first of the year to help promote that. Many, many things going on. And I think the number one name of the game is all of us working together to do the right things to get across this bridge.
Thank you. I appreciate you taking some time to help us on that. Could we just spend a minute? This is a business audience, and many of our the people on the phone are asking questions about how they, as a business, can implement vaccine strategies or participate in that. And so they're asking, is it possible for, like you have a flu shot clinic in your business and people that come to you to administer to your employees? Is that likely to be, or should they be working with their health plans, which is typically what employers think about as their first line of action, or is this all direct to the providers? You've spoken about pharmacies and providers and health departments, but tell us a little more about that, if you would, Rich.
Yeah. So as we roll this vaccine out, we understand that many businesses do have flu clinics where they have, for example, community nursing services that may come in and do that. Unfortunately, for this response, the idea is to get the vaccine out to all of those mentioned, hopefully every pharmacy on every block has got vaccine. All the local health departments have vaccine. Community health centers have vaccine. Private physicians have vaccine. And so there's a number of options where the general public, so those that are working at these businesses, really is convenient for them to go somewhere. For me, the convenience of going to a pharmacy is very important, and very easy. But they also have the option, if they're comfortable going to their private physician, they also have that opportunity. So unfortunately, the larger systems, they will receive vaccine so that they can vaccinate their staff. When I talk about systems, I mean like clinics, like Tanner Clinic, and some of these larger ones will receive vaccine. But when it comes to individual businesses, those employees at those will have to go to those partners that I just mentioned.
And then just have a couple more questions I'd like to round to, more specific coming out of the Q&A that I found interesting. Could you just kind of speak to what we know about maintaining immunity from this? Is this like the flu vaccine where we have to get a shot every year, or is this long-term? What do we know about that right now?
Yep, that's a great question. I think I get that by the media most. Is this going to be something that we just get once? So we don't know that data yet. I think we'll know more when the EUA is approved on the 10th and ACIP makes a recommendation. So we're going to know a little bit more about that. But in regards to a lifelong, like if we're going to have lifelong immunity, we don't know that yet. Do we know if this will be an annual vaccine? It could be. Unfortunately, I just don't have a nice black and white answer for you until we get more data and learn more about this vaccine. Unfortunately, to me, it looks like that the possibility of it being a vaccine like the MMR, the measles, mumps, and rubella, that once you get your second vaccine, you have lifelong immunity. But we'll see. We'll see as we go down the road.
Okay, I appreciate that. We'll watch for more information as it becomes available, because I think that has significant impact for all of us. And then just one last question to round out this section. Could you just review, I think there was interest in how one would access the Docket app that you mentioned. I mean, where do you go to get it? Who do you talk to? What's the website you can refer to if you wanted that information?
Yep. So it's a DOCKET. So if you go into your what is it, apps folder on either your Android or your iPhone, and you type in that Docket, then you can download that app and then just follow the instructions there. And actually that app will then kind of start to interface with our registry so that you can have access to your vaccination records.
Okay. Thank you.
Hey, Mark.
Yes, Rich.
Just one follow-up. I just want you to know that while we've been talking, I've reached out to our legal counsel, both the executive branch as well as internally at the Department of Health, on whether or not an employee can mandate its employees. An employer can mandate its employees to be vaccinated. And I've gotten mixed response. So I would say it's not a for sure. I think there are some protections in place that make it so that employer cannot actually mandate it. But again, we're checking in with the Labor Commission and their legal side as well, just to make sure, and I'll get you a more robust response.
Great, thank you. Any final comments from you, Rich, or either Rich, about before we transition that you'd like to draw as a close?
Rich, go ahead if you've got any.
No, I was just going to turn that over to you, Rich, as the executive director.
No, I just appreciate Rich Lake and his team and the community that's come together on this vaccination effort. It is huge. And we will rely on our community to come together to successfully execute the plans of getting the population vaccinated. Thank you for the time that we've had to be able to spend with you. We have thoroughly enjoyed our relationship through this and become better because of the members of the Salt Lake Chamber and others that are involved and have been so closely linked with the Utah Department of Health, the governor's office, and all things that have taken place. And our partners, thank you for all that you do, your patience, your goodness, your guidance, your direction. You're remarkable. We're grateful to be associated with you. Thank you.
Thank you, Rich and Rich. We appreciate your valuable insight, and we're grateful for your service in support of the citizens of Utah. We now are going to switch gears a little bit, and we're going to turn to Jack Hedge of the Utah Inland Port Authority, who's going to help provide us a little bit of answer to a few questions about supply chain management of the COVID-19 vaccine in Utah. We've seen in the news that Utah has been called a cold chain link for distribution. Jack, can you just introduce yourself and start there and give us a little background on what that means?
Sure, Mark, thanks. And first of all, thank you to the Salt Lake Chamber for having me be part of this today. We appreciate it and appreciate the opportunity to talk a little bit about the cold chain, refrigerated logistics, and the role that it plays in distributing things like the COVID vaccine out to folks like Rich and Rich and others around the state. So what do we mean by cold chain? Well, the cold chain is a piece of the logistics system, the national logistics system, that moves every day a tremendous amount of pharmaceutical goods, frozen food, fruits, vegetables, just about everything that has to be chilled to be moved moves in the cold chain. And Utah is uniquely positioned in the national cold chain because of the amount of refrigerated product that moves to and through Utah on a daily basis. It's a significant amount of the traffic in the United States moves to and through Utah on a daily basis. And I'll show you something there in a minute. But first of all, I want to talk a little bit about, there's different ranges, temperature ranges in the cold chain. It goes from what we call banana, which is just what it sounds like. It's just cold enough to keep bananas from over ripening too quickly. So it's actually not even below freezing. Up all the way up to the ultra cold level that gets down to about negative 70, 80 degrees C. And that's the portion of the cold chain that the Pfizer vaccine needs to access to be distributed. And there's a whole range in between. So as other vaccines come to market, Moderna vaccine, for example, doesn't have to be maintained at as cold a level as the Pfizer vaccine. Different parts of the cold chain fit different aspects of it. So it's a really, in my mind, it's a very interesting thing to do. The number of, it's also though, in addition to those warehouses and that cold storage, it's the ability to move trailers, refrigerated trailers that are called reefers, through the system, up and down our freeway, interstate system, connect with air traffic, air cargo, and Salt Lake City is a hub for air cargo for distribution of this. Connect those trucks to those air cargo ramps so that cargo then can be moved safely to the refrigerated warehouses, and from there on to the distribution center that Rich and Rich were talking about a little bit earlier. So just so you understand how much cold chain is concentrated here in Utah, about 17% of all the freight that originates in Utah, all the produce, all the mining material, all the manufactured goods, whatever, about 17% of that freight that starts here in Utah is refrigerated. We have a huge food processing industry in this state. And so by volume, a huge chunk of our economy is built around refrigerated distribution, refrigerated processing and distribution. So we have a lot of infrastructure in this state. And it's a good thing too, because about 30% of the nation's refrigerated cargo moves through Utah, primarily along I-80 and I-84, That's the primary corridor for goods movement of refrigerated cargo through the United States, through the Western United States. And the region that we serve, the Intermountain region that we serve, is gigantic. From this area, we serve everything from north of Boise down to Phoenix, over to Reno and east of Denver. So it's a huge market area that is served by this logistics network. But that pipeline, that I-80, I-84 pipeline, is the major connector route for refrigerated cargoes, including pharmaceuticals and the vaccine, between Chicago, the upper Midwest, and the West Coast. So it is a critical lifeline in distributing this COVID vaccine efficiently and effectively across the US. About 50% of the trucks on a daily basis, especially during peak seasons, harvest seasons, things like that, but about 50% of the trucks on I-80 on any given day are refrigerated carriers, hauling refrigerated goods. So it's a huge, vitally important part of the supply chain. I would argue to the folks at the health department and the immunology department that truck drivers and warehouse workers in the cold chain particularly are essential workers, and because if they break down, if that piece falls apart, then distribution of the vaccine becomes impaired. So let me show you a little bit about what I was just talking about. I think there's a slide that can be put up, and if not, that's fine. There we go. There we go. So that's some of the stats I was talking about. But as you can see, the major interstate freeway corridors move right through Utah. It's like a funnel between the West Coast and the upper Midwest. And you can see how it's a critical link in the supply chain for moving these refrigerated cargoes to and through. So as they move from the Midwest, the first loads that are airlifted out into Salt Lake City, but also into the West Coast. But then those secondary loads, and then as it expands over time by truck, we are truly the crossroads of the West when it comes to distributing that vaccine. So this graphic really sort of points that out, and I think helps make that point very clear. So we are, a couple of things that we're looking at right now is trying to identify within the state what are those warehouse and distribution assets that are appropriate for this use, that have these capabilities, the different capabilities, especially the ultra cold capabilities, because the Pfizer and the Moderna vaccines take two different sorts of levels of refrigeration and distribution, and as more vaccines come available, those things will be as well. But to give you some idea of the scope of this, I was on the phone yesterday with some colleagues at Maersk, the largest shipping company in the world, and he likened this to the largest logistics operation in history, possibly in history, certainly since the end of World War II, moving these goods nationally and internationally so that the vaccines can get into the hands of people like Rich Lakin and others to get out to us to help stem the tide of this virus is a huge undertaking. And it's going to take a lot of the system that we have in place, looking at the system, figuring out how to make it work better, identify bottlenecks and address those bottlenecks. All those kinds of things are things that we're working on. So hope that's helpful. Hope that gave everybody some things to think about.
Thank you, Jack. I appreciate the update and the following through on that. We've reached the end of our time together, and so I'm going to return it back over to Mikelle for closing comments.
Thank you, Mark, and thank you, Jack, and also to Rich and Rich. What great support you have provided us as a state. So grateful to hear your messages today and know that you're bringing these resources to us here in Utah. I'd like to thank everyone for joining us today. As a reminder, this webinar was sponsored by the Salt Lake Chamber's Roadmap to Recovery Coalition. If you'd like to learn more about how you can get involved, please visit slchamber.com. Thanks, everyone, and have a great day.